I'm a tenured full professor in NUS in the Department of Orthopedic Surgery. I'm also a senior consultant in NUH. So my work got to do a lot of treatment of patients with cartilage and knee pain and all that. But on the sideline, not the sideline, on my research side, I basically deal with research into the use of stem cells in healing of cartilage, healing of bone, healing of tendon ligament, and a lot of the sports injuries. For all intents and purposes, for clinical practice would be, we are talking about the multipotent stem cells which can reside in bone marrow, reside in like even your fat, in your other part of your body, which can be harvested and cultured and then can be sort of like you adjusted and differentiated into the tissue you want. Yeah, so that is called multipotent stem cells. The good thing what I use are all autologous, means from patient's own body. So far in Singapore, I only do autologous because I feel it's, like you say, side effect wise, it's very safe. There's no rejection from their own body. And so far in we have like over 400 patients, and still none of them have any like side effect like tumor formation or infection, all that. And it's, we follow them up really very, very safe because it's their own body's cells. At the moment, we still do it under clinical trial. Yeah. Therefore, in a sense, you can still come to hospital and we'll still do this under the sort of like the framework of clinical trial. Yeah. So patient know well in advance this is not established practice. Therefore, you understand the so-called the risk you're taking. It may not be as efficacious as what you expect, but we guarantee the safety, sort of like safe environment, so that nothing bad will happen to you. Once all our clinical trial results are going to be established, then we are going to discuss with HSA and Ministry of Health. Then this will be brought more in the realm of like so-called more of a clinical use. It's not so much better, but the latest, the International Cartilage Repair Society, the latest meeting they have, what they put the theme of the meeting? I'm not ready for metals. They actually use this very catchy theme. The reason is this, because the moment you use metal, it means when the metals wear out, you need to have revision. You need to replace again. Then every time you replace, you need to cut the bone deeper. If at 40 plus, some people are quite crazy, had a joint replacement. That means in 12 years later, 50 plus, you had the first revision, 60 plus, second revision, 70 plus, third revision. How many bone can you cut away to revive? So the risk of having revision is really no good. Well, cells are not so-called better, but at least if I revise you, I don't cut any bone away. I'm just try to repair again your cartilage and all that. But I must say, cells can never replicate into metal in terms of relief of pain. Because cells, it depends on cells grow back to cartilage. Well, metal, you know why? I cut away all the nerve ending, you see. Of course you got no pain because after that it's just your metal rub against your own metal. So you are sort of like no pain because you have no feeling. You understand? You're inside. Metal on plastic, no feeling. Yeah. And some people used to say it's like a form of internal amputation because you are amputating away the nerve ending. I don't think so. Initially, they're not all bad. They're like 40% of cartilage, and then the average is like going to about 75%, 79%, like that. Yeah. If even successful repair, I found that patients don't get as good as